Well, a lot of Americans a little weary of talking about COVID, but there is another surge happening worldwide. I want to talk about the effects on Connecticut here. Dr. Hussain from Trinity Health of New England joining us again, sir.
Good morning.
Good to see you.
Thank you.
Yes. All right. Talking about BA4, specifically even the BA5 subvariant of Omicron. We're seeing a rise, as we reported, in cases and hospitalizations worldwide. Not seeing huge ones in Connecticut, but what do people need to know if they're, once again, worried about it? They just can't afford to really get infected again.
Sure. So BA5 is on track to becoming the most dominant strain here in this country. Mm-hmm. It's causing a rise in cases in Europe. We usually lag Europe by several weeks. So Italy, Germany, France are all seeing a rise in cases. So we expect that to happen. But the thing that I tell folks, the most important tool in our arsenal is getting vaccinated. If you're eligible for the booster, get boosted. If your child is due for the vaccination, get them vaccinated.
And that's because even though the vaccines appear to be a little less effective at stopping infection, that's only half the story. The other half is what happens if you do get infected.
That's right, absolutely. And, you know, prior to the Omicron variant, Tim, when we were dealing with Delta, the common perception in the scientific community was that we would have enough vaccine-induced immunity or infection-induced immunity to ride this out, and coronavirus may become an annual thing like the flu where we might see a spurt in cases. Yeah. But now we're probably looking at 2-3 times a year where people can get infected, reinfected, and it's behaving more and more like the common cold coronavirus, like its cousins.
Yes, which is something that is not unexpected, but does it mean we have to change our strategy? We have people asking, hey, if I've had COVID-19, do I need to get a booster? I guess we can even make the question more specific. If I've had COVID in the last month or 2 months or 6 months, should I be getting a booster? Do I need to get one?
Great question. So I encourage folks to look at the data because the data tells its own story. Those that have gotten the vaccine will have much longer lasting and stronger immunity, especially to prevent severe outcomes. Yes, it doesn't, the vaccine isn't as protective against infection, but infection is usually mild, especially with these newer subvariants that are able to dodge vaccine-mediated immunity. But having said that, it still confers a large benefit in terms of preventing severe outcomes.
Do we know if it is still providing a fair amount of benefit in terms of stopping you from transmitting it? For a while, I thought there was a correlation between how much of the virus you get in your body that may make you more likely to get sick and more likely to transmit it. But with less viral load comes less transmissibility. Do we know where we stand with that?
Theoretically, yes, but it's hard to measure, especially because the subvariants have become more and more contagious. Yeah. So it adds a little bit of complexity to the mix.
All right, last quick question here. People asking if I'm high risk and I wear a mask but nobody else is around, is it just too little of an effect at this point, or a protective effect?
Masks will protect you, even if nobody else is wearing them. It depends on the type of mask you're wearing. Yeah. So N95s are the gold standard, but it also depends on your surroundings. Mm-hmm. Are you indoors? Is it a crowded situation? Is there proper ventilation? So all those things you need to take into account. If you are interacting with people who are not wearing a mask, is your mask first and foremost a good quality mask? Yeah. And how long are you interacting with them for? It all goes into, you know, the risk of exposure.
Yeah. So wearing the mask helps. How you manage your interactions with people, I think, could have just as much, maybe if not a bigger effect. Doctor, thank you so much.
Thank you.
Good to see you again.
Thank you.
As always, we appreciate the knowledge. Matt, let's get right out there. I know we got a lot of things to talk about weather-wise.